Good afternoon, and welcome to CAN TV Cable 21. My name is Lucy Aquino, and I'm the Chief Executive Officer of Hispanocare, Inc., a program of Advocate Illinois Masonic Medical Center. Today, our topic is rheumatoid arthritis and osteoarthritis. Very important topic that a lot of folks have been asking us to talk about. I have with me today a special guest, rheumatologist Dr. Siddarth Tambar of Advocate Illinois Masonic Medical Center. Doctor, thank you so much for being here with us today.
It's my pleasure to be here.
And actually, you've been with us before. It's been a while since we've had you back, though.
Right.
So it's really, really good to see you again and coming out. I know that we are getting requests a lot for us to talk more about arthritis. So that being said, Doctor, while we know that there's 1.5 million individuals in the United States that have been diagnosed with rheumatoid arthritis or RA, and over 20 million people have been diagnosed with osteoarthritis. And we know that these individuals, for their care, would look into reaching out to a rheumatologist. But what is a rheumatologist? And what are the diseases that, in this case, you would treat?
Yeah, well, I mean, the two main subset of conditions that I would treat are essentially arthritis, either related to inflammatory arthritis or mechanical arthritis. So what that means is either conditions like rheumatoid arthritis, psoriatic arthritis, or just regular wear and tear arthritis and tendinitis. So it's a wide spectrum of conditions, and as a rheumatologist, non-surgical management of arthritis really across the board.
Okay, so I know that RA causes tremendous pains in the joints. And what are some of those common causes of joint pain?
Common causes of joint pain, there's really quite a few different causes. The two main ones that I think of are either wear and tear arthritis that can happen with age or with injuries, or conditions like rheumatoid arthritis where your immune system is overly active and causing damage in the joints. I generally approach arthritis, it's either in the category of wear and tear or in the category of your immune systems being overly active. It's important to differentiate between the two because the treatments that we use are really dramatically different depending on what's causing your arthritis.
So when we're talking about rheumatoid arthritis or RA, is that inflammation of the joints that causes fluid of the joints, or is that something totally different?
No, absolutely. Essentially, rheumatoid arthritis is where your immune system is miscommunicating, causing inflammation in the joints, which causes pain, swelling, and disability.
So we're talking that as the joints inflame. Oh, I wanted to see. Is this something that we would use for?
Absolutely.
I want to bring this up, and I think it's something that we can utilize over here. So, Doctor, if you were to show, we're showing this here, a normal joint versus an osteoarthritis or RA. What can we point out here?
Well, on your left side, you have a normal joint, which shows bony structure that's intact and normal, a joint capsule that's normal, the muscles and tendons are normal. On the far right, you have an example of a rheumatoid arthritis joint where you have a lot of inflammation, a lot of swelling that at that time is showing a lot of swelling and inflammation, and if that remains, eventually that'll start to cause a lot of damage, a lot more pain, and eventually a lot more bony damage as well. The picture in between is of a wear and tear arthritis joint where you actually have breakdown of the cartilage or the cushion between the bones, which causes arthritis and pain. So really completely different mechanisms of causing pain. In the end, people end up having pain in similar joints as well as functional limitations.
Wow. So there is a lot of difference. And, of course, the treatments are different as well. So when we talk about, today it's a whole new century. Medicine has changed tremendously, especially for RA. Yeah. Can you tell us about some of the new treatments that are out there versus some of the old treatments? And I also want to touch on some of the home remedies or herbal remedies are out there as well, because I know we hear that a lot from our community too, that they're using these home remedies and herbal remedies that they're even bringing back from home.
Yeah, I would say first and foremost from the medical side, there are dramatic changes in the last 10 years, and since I was last year, 5 years ago, there have been tremendous advances for treatment of really arthritis across the board. A lot of exciting things. Some are medication-wise, some are non-medications that are really making big differences in people's lives. Whether you're talking about the rheumatoid arthritis standpoint, the psoriatic arthritis standpoint, or even just regular old-fashioned osteoarthritis and tendonitis. From the standpoint of home remedies, when I think of what are things an individual can do, I think of kind of a couple different categories. Number one is the example I would give is myself. I'd injured my shoulder playing tennis a couple years ago, and the things that made the biggest difference for me, quite frankly, was working with a physical therapist who helped me make some changes in how I was exercising and playing tennis, making the kind of appropriate biomechanical changes that are really simple but take a thoughtful approach, and that'll really prevent this from getting worse. I think that's probably the best homemade remedy that a person can take, which is correcting the reason why you developed the pain to begin with. In terms of over-the-counter or home stuff that can make a difference, from a rheumatoid arthritis standpoint, the thing that is most helpful is probably omega-3, which you can get in either fish oil or in flaxseed oil. There is a study showing that a high enough dosage of omega-3 can make a difference in terms of reducing inflammation. That's good for cholesterol as well, so it's a nice supplement that really anyone can get over the counter. There are a number of other things that are hypothesized to maybe help with inflammation as well. Things like turmeric, curcumin. I think those are all worthwhile to take. That goes in well with a lot of different foods as well. So I think that can work from a dietary standpoint as well. From the wear and tear arthritis standpoint, glucosamine chondroitin has been around for many years. Can help some people with pain as well. So I think from the medical standpoint, there's dramatic stuff that we're doing now that are so much better than what we were doing even 5 years ago. And I think even from the the things that you can do on your own at home before you even go to see the doctor, there are a number of things that you can do as well.
Oh, I do want to remind our viewers that our lines are open. The numbers at the bottom of your screen, area code 312-738-1060. If you have any questions for Dr. Tambar, please give us a call. Lines are open. So Dr. Tambar, the medicines that are out there today, the treatments that are out there, I know that sometimes we run into some of our community folks when we're out there and they're telling us about their arthritis, but they tend to stay stationary and they don't want to go and they don't believe that exercise will help them, which indeed it does.
Absolutely. I mean, exercise done in an appropriate way is a form of medicine itself. Whether you're talking about someone who has knee arthritis, strengthening the muscles and joints around the knee makes a big difference. I think exercise and maintaining an active lifestyle are obviously very key for not only your quality of life, but even treating arthritis as well. I think the key things are coordinated in a way that is safe with a professional who can help you out to make sure that you're strengthening the right areas and doing things in a safe manner. So I think a goal of staying physically active your entire life is obviously very important. And I think a goal of utilizing exercise in an appropriate, targeted way for treatment of arthritis is definitely appropriate also.
So, doctor, there are also individuals out there who self-diagnose. We're always self-diagnosing. But what are the signs and symptoms for someone who may have RA?
Yeah, I mean, it's pain and swelling. For RA, it's classically pain and swelling in the hands and the feet, but realistically it can happen in any joint. I think if you find that you're getting painful, swollen joints, symptoms that are worse with rest and better with activity, that's pretty classic for RA. That's really different than wear and tear arthritis, where it's pain that's worse with activity and better with rest. I think if you have symptoms that are pretty classic in that regard, get checked out. Getting treated earlier rather than later is really what makes the biggest difference in terms of eventual patient outcomes and and staying healthy long term.
And what are some of the long-term effects for someone with RA?
Yeah, I mean, progressive, if you keep that inflammation in a joint, eventually it's going to damage the bone. Once that bone has been damaged, you can't really reverse that damage. You can reverse inflammation, but you can't reverse bony damage. And once you develop bony damage, there's a risk of having more pain, eventually disability, and difficulty working, difficulty exercising, just difficulty enjoying your life. There is sort of a window of opportunity where if you can treat somebody before they develop too much damage, you can make a big difference in terms of their in terms of their pain, their function, and really their long-term outcome.
Now, with the inflammation or RA as that particular arthritis that's happening, does it also affect the organs at all?
It can. We know that patients who've got RA also have higher rates of heart disease long-term, higher rates of lymphoma cancer long-term as well. So it's a condition that does more than just affect the joints. The effect on the joints is very important because it causes such a significant amount of decline in functional ability and quality of life. But certainly there are definitely life-threatening issues regarding heart and cancer as well that people with RA deal with.
I do want to remind our viewers that with us today is Dr. Siddarth Tambar, located at 2800 North Sheridan Road in Suite 308 here in Chicago. At his phone number, and he's willing to take questions if you have them. Please give him a call at area code 773-348-7171. We can also reach him over at chicagoarthritis.com. Again, Siddarth Tambar, who's here with us today, talking about rheumatoid arthritis and osteoarthritis. So we talked a little bit about, there's a lot of new treatments, but when you're saying new treatments, what are you exactly talking about?
Yeah, it really depends on the condition we're talking about. For rheumatoid arthritis, there's a lot of new medications that are available that can really put the condition into remission. There's nothing that can really cure that condition, but there are certainly treatments that can put it straight into remission where pain and swelling and functional limitations should be well controlled. For wear and tear arthritis or tendonitis, we have brand new treatments that are non-medication based, things that come from your own blood or stem cells that can help to actually heal mild to moderate injuries, and even in more severe arthritis can help treat pain and functional limitation. A lot of these treatments are very new, just in the last few years. They're advancing pretty rapidly, and I think the long-term outlook for arthritis is dramatically better than it's really ever been before.
Wow. So there has been a lot of changes. So individuals who have been diagnosed with RA or osteoarthritis and hasn't seen a physician in a long time or hasn't followed up, it's time for you to follow up. There are new treatments out there. There are things that are better for you than they were 5 years ago, as you were saying.
Definitely.
So, doctor, some of the serious side effects, I know individuals also talk about side effects and treatments in general. I'm not sure about the new ones, but at least some of the old ones. And what can some of those side effects be? And what should individuals be looking for, or even just deciding to go see a specialist?
Right. I think it's important to recognize there's an old paradigm of treatment and there's a new paradigm. The old paradigm is take pain medications, mask the pain, basically kind of grin and bear it. Maybe try some physical therapy, try a steroid injection, and eventually just kind of wait until it gets bad enough where you need surgery. That's a terrible paradigm. I think a better, newer paradigm is, hey, let's figure out what's the source of your problem.
Right.
Let's control that. Let's prevent that issue from getting worse. If there are treatments that can help to reverse some of those issues, let's do that. And let's actually prevent the requirement for pain medications. Let's reduce the requirement for steroid injections, which are not good for you. And then eventually let's even prevent surgery down the line. The issues with some of the pain medications can include, addiction issues, kidney, liver, even cardiac issues. Surgery is not a benign thing either. If we can do things that are considered safer and actually prevent progressive damage and future problems, we may be able to prevent a lot of those side effects from the old paradigm treatments.
Right. Very important. And I know that a lot of times patients or individuals in general just get stuck on what it is you're used to doing. And there's no way of changing their mind. But in reality, there's just so many new options out there.
Absolutely. I think the important thing is if you're stuck using the old model, number one, make sure you've explored what are some of the newer models. The new school sometimes has a lot of good ideas. Sometimes the old school way of doing things, there's good things to it, but quite frankly, you should listen to some of the newer ideas as well.
Well, we know that also this Western diet that we have doesn't help.
Absolutely. I mean, unfortunately, the nature of how we live in modern day life is we're not as active as we should be.
Right.
We tend to have questionable eating habits at times.
Right.
None of those things are really good for us long term. And I think the common sense ideas of eating healthy and staying active, the kind of things your mom would tell you. I mean, those are they ring true whether you're 38 or 8 years old. So
Yeah. So many changes, but exercise in general is good for you. I can
Definitely.
only imagine how much more it can help with someone who has RA or osteoarthritis. Can we talk a little bit about osteoarthritis directly? What can you tell us about it?
Right. So I mean, osteoarthritis. The other term for it is wear and tear arthritis. Is basically the arthritis that develops in really most of us as we age. But certainly it can be accelerated if you've done any sort of significant athletic activities in the past, if you've had any injuries in the past, if you have too much weight as well, putting too much pressure on a joint. It's a common form of arthritis. Hearing that it affects 20 million seems low to me.
Wow.
It's probably the vast majority of people eventually get osteoarthritis in most societies. Certainly, if you're over the age of 50, there's a very high prevalence of it. Probably 20 million are the only people that are presenting, for evaluation for it. But if you asked across the board how many people have aches and pains anywhere, that would probably be most
Here
people.
all the time. Right.
Just sitting here right now, I have a little ache in my back. So I think we all have some degree of wear and tear arthritis that slowly accumulates over time. Again, the old model of treatment for that was wait until it gets severely bad before you actually do something about it. A better model is correct your biomechanical issues that are causing problems, improve your diet that may be influencing excessive weight to prevent putting too much pressure on the joints that are problematic. And then, if that's not working, then consider some of the newer treatments that are available that can help to either repair mild damage or even treat more excessive damage.
Is osteoarthritis treated the same way as RA?
It's not. While there are similar ideas behind improving biomechanics and exercise, the actual treatments that are used are different. The kind of medications that are used for rheumatoid arthritis really are not appropriate and don't really help wear and tear arthritis. I think avoiding, again, pain medications or steroid injections is probably in everyone's best interest. Avoiding surgery unless you have something that's really too advanced or severe can be done as well in an earlier stage. The kind of treatments that are newer that we're exploring and starting to use for wear and tear arthritis and tendonitis include things like platelet-rich plasma, even your own stem cells. These are treatments that come from either your own blood or your own bone marrow. These are more aggressive treatments, but they're appropriate and safe treatments in people that have failed basics of physical therapy, relative rest, and are really starting to develop too much pain or functional impairments.
That is good to know. I mean, there is so much out there. There are websites, tremendous websites that are out there with a lot of information. But most importantly, follow up with your physician.
Right.
Again, I will remind our viewers that our lines are open. If you have any questions, please give us a call at area code 312-738-1060. I want to remind you that Dr. Siddarth Tambar is here with us today. And if you have any questions, please give him a call, 773-348-7171, or you can go to chicagoarthritis.com. Doctor, if you can give anyone advice, especially when it comes to the natural remedies for what they say is out there for rheumatoid arthritis, what would you tell people?
Yeah, I'd say number one, the things that you can easily do, right, which are exercise and diet, will help. For rheumatoid arthritis, omega-3 can help for mild stuff. I think the key thing is, if you're taking a natural remedy for rheumatoid arthritis, make sure that you don't have any features or risks of developing more aggressive progressive damage. Once you develop that kind of damage in the bones, you can't really reverse it. I think you can do a lot of the natural stuff. You can do them appropriately, if your physician is open-minded to those things as well. The ways that I would recommend making sure you're not at risk for real problems is by making sure that you don't have any of the findings that are kind of alarm bells to me, which are really high levels of inflammation that I would see either on exam or ultrasound or lab testing. But I think for milder disease, using some of the homemade stuff like omega-3 or turmeric, I think is appropriate. I think you just want to be careful that you're not at risk of developing more aggressive, damaging disease.
Now, water aerobics is good.
Fantastic.
And it's something that you don't have to work super hard on. Something you would recommend.
Absolutely. You can still work hard in the water. You can still get an excellent workout. I think water aerobics are great for a lot of arthritis patients, definitely for people that have arthritis in the lower back or in the lower extremities, knees, feet, ankles. Number one, it is a lot easier on those joints. It's zero gravity. You can still strengthen the muscles, which is the goal. And it feels good to be in a warm pool as well. So I think it's a great treatment modality that we really underutilize, unfortunately, in a place like Chicago.
And there's so many YMCAs now that are out there that have opened up throughout the city, and other centers that are out there, health centers and park districts that are out there that actually have pools and actually have these types of classes that they're providing for community. Definitely something to look into in your community as well. Low cost for memberships. I mean, things have changed quite a bit in the last 5 years.
I think if you can find a good, convenient, low-cost option, I think it is a really great thing to add to your exercise regimen or your arthritis treatment regimen. Low risk, can help with pain, it can make a big difference long term. So again, I think maximize and consider all the low risk, quality stuff that can make a difference in your life.
Dr. Tambar, what else can arthritis patients do to prevent their arthritis from getting worse? And we know there's not a cure for it, but you can definitely prevent it from getting worse.
I think be open-minded to newer treatment ideas and regimens. I think work with providers, whether it's physician, physical therapist, whoever, that is open-minded to some of the newer concepts. I think don't accept a poor quality life. Don't accept just relying on pain medications. Don't accept don't accept bad outcomes. Really have high expectations, not only in yourself but in your providers. And I think if you push for better quality care, better expectations, I think you'll get that.
And I totally agree. Individuals do need to take care of themselves. I mean, only you can prevent these things from happening by following up, by seeing your doctor, and just staying in touch with what's going on. What new treatments are out there? The internet is a wonderful place to be, but sometimes it may not lead you the way you need to go. So always consult with your physician. Always follow up with your primary care.
It's interesting. A lot of patients, before they tell me they've read something on the internet, they always apologize. I'm sorry I read this on the internet. But the truth is, there's a lot of good quality information on the internet. And even physicians, I mean, we do get information from the internet as well. So I think if your physician is open to discussion with you, that's the kind of relationship you want to have.
Well, Dr. Tambar, our time here goes by so quickly. I would love to have you back. I mean, there's a lot of other things that we want to talk about, but love to have you back and get you back real soon that we can talk more about RA and osteoarthritis and just a whole lot of other topics that we can get into. So in closing today's show, we want to thank you on behalf of our colleagues at Hispanocare at Advocate Illinois Masonic Medical Center. Dr. Tambar, thank you so much for being on the show, and thank you for coming back and for allowing us to share with you this important information. So stay tuned. More information's coming up. See you next month. We hope to see you soon. And again, Dr. Tambar, if anyone needs to get a hold of you and have any questions, they can reach you at 773-348-7171 or chicagoarthritis.com. Until next time, we'll see you soon. Stay tuned. More information coming your way. Good night.